Verify the healthcare provider's orders. Gather the necessary equipment and supplies. Perform hand hygiene. Provide for the patient's privacy. Introduce yourself to the patient and family if present. Identify the patient. Assess the patient's tolerance for bathing and activity, comfort level, cognitive ability, and musculoskeletal function. Assess for shortness of breath. Assess the condition of skin. Arrange all supplies on the overt bed table. Raise the bed to a comfortable working height. Lower the rail on your side and help the patient assume a comfortable supine position, maintaining body alignment. Bring the patient toward the same side. Place a bath blanket over the patient. Have the patient hold the top of the bath blanket and remove the top sheet from beneath the bath blanket without exposing the patient. Place soiled linen in the dirty linen bag. Remove the patient's gown or pajamas. Unsnap the sleeves and remove the gown. If an extremity is injured, begin removal from the unaffected side first. Remove the gown from the arm without the intravenous line first, then remove the gown from the arm with the intravenous line. Do not disconnect the intravenous tubing to remove the gown. Raise the side rails and lower the bed to a comfortable working height for the bath. Fill a wash basin cloth thirds full of warm water. Check the water temperature and have the patient place his or her fingers in the water to test temperature tolerance. Remove the pillow if the patient's condition allows. Raise the head of the bed 30 to 45 degrees. Place a bath towel under the patient's head. Place a second bath towel over the patient's chest. Wash the face. Inquire whether the patient is wearing contact lenses. Immerse the washcloth and wring out thoroughly from a mitt with a washcloth. Wash the patient's eyes with plain warm water, using a clean area of the cloth for each eye. Bathing from the inner to the outer canthus. Soak any crust of the eyelid for 2 to 3 minutes with a damp cloth. Dry gently and thoroughly around the eyes. Ask if the patient wishes to use soap on the face, then wash, rinse, and dry the forehead, cheeks, nose, neck, and areas as male patient if they would like to be shaved. Provide eye care for the unconscious patient and still prescribe eye drops or ointment per the physician's order. Close each eye gently using the back of your fingertip before tapping in place an eye patch or shield. Wash the upper extremities and trunk. Remove the bath blanket from beneath the patient's arm and that is closer to you. Place the bath towel lengthwise under the arm. Bath with water and minimal soap, using long, firm stroke and moving in a distal to proximal, fingers to axilla direction. Rinse and dry the arm. Wash the hands and nails. Fold a bath towel in half and lay it on the bedside the patient. Move to the other side of the bed and repeat this step with the patient's other arm, axilla, hand, and nails. Cover the patient's chest with a bath towel and fold the bath blanket down to the umbilicus. Bath the chest using long, firm stroke. Bath, rinse, and dry the abdomen, paying special attention to the umbilicus and the surrounding skin folds of the abdomen and groin. Keep the abdomen covered between washing and rinsing. Dry well. Wash the lower extremities. Cover the chest and abdomen with the top of the bath blanket. Expose legs closer to you by folding the blanket towards the midline. Be sure the other leg and the perineum remain draped. Place this towel lengthwise under the leg. Wash the leg using long, firm strokes and moving from ankle to knee, and then from knee to thigh. Thoroughly rinse and dry the leg. Wash the foot, making sure to clean between the toes. Clean the file and nails as needed, or per agency policy, rinse and dry the toes and feet completely. Remove the towel, raise the side rail, move to the other side of the bed, lower the side rail, and repeat step 19 A, B, and C for the other leg and foot. Apply a light layer of moisturizing lotion to both feet. Place soiled towels in dry linen bag. While the patient is supine, provide perineal care. Cover the patient with a bath blanket, raise the side rail, and change the bath water. Wash the back, apply a clean pair of gloves, lower the side rail, help the patient assume a prone or side-lying position. Place a clean towel lengthwise along the patient's side or back. Keep the patient draped by sliding the bath blanket over the shoulder and thighs during bathing. Wash, rinse, and dry the back from neck to buttocks using long, firm stroke. Cleanse the buttocks and anus, moving from front to back. Pay special attention to the folds of the buttocks and anus. Rinse and dry the area thoroughly if needed. Place a clean absorbent pad under the patient buttocks. If the patient's skin is intact, remove your gloves and give the patient back massage if he or she would like one. Apply body lotion to the skin and tropical moisturizing agent to dry, flaky, redundant, or scaling areas. When you are finished, cover the patient with a bath blanket, put a clean gown or a pajama top on the patient by dressing the affected side first, if not done earlier. Assist the patient with grooming, comb the patient hair, apply clean gloves, and make the patient's bed. Remove soiled linen and place it in the dirty linen bag. Remove gloves and perform hand hygiene. Check the function and position of external devices such as indwelling, catheters, nasogastric tube, intravenous tube, and braces. Replace the call light and neatly arrange personal possessions. Place the bed in the lock-low position with at least 2 side rails raised. Make sure the patient is as comfortable. Dispose of used supplies and equipment. Perform hand hygiene. Document and report the patient's response and expected or unexpected outcomes.